We've placed our bone. Now we've placed our HeliPLUG into the socket. And then finally we've closed over the socket with sutures, basically holding that HeliPLUG in place. That HeliPLUG is going to create a very strong blood clot, and it's going to basically stabilize this wound. And then we go through all the steps of healing that we talked about last time as the epithelium closes over the top of the new granulation tissue. At 4 months healing, we can see a nice sealed up socket, indentation in the middle where the middle of the socket is, but the epithelium has closed over, and we have new bone underneath that has grown in. Then we're able to place our implants into our new regenerated bone from the socket bone graft. If we have a large socket like this, you can still use HeliPLUG or HeliTAPE, and you can basically divide it up into pieces and cover over the socket. At the end, the same thing needs to happen, where we go ahead and we take our suture. We're going to go ahead and close over the top. There's some good examples of this on YouTube. You can go to my name on YouTube, Joel Henriod, best way to find it, and there's a series of kind of how-tos and tips on there. And so we want to use our sutures to stabilize things. Okay, and then we've got our healing. So this is now a different type of socket preservation, okay? We've raised a buccal flap, and now we've closed, like a lid, we've closed the HeliMEND over the top of the socket. So the HeliMEND is now tucked from the buccal over to the palatal, and so this is not a dressing, now it's a membrane. It's being used to fortify the buccal plate, and in the same way as we did with our plug or HeliTAPE, we're going to basically close over with suture, get everything closed, and allow that socket to be stabilized.